Hello, good morning.
Good morning, doctor.
I'm Dr. Bishwas. I'm a doctor of this clinic. May I confirm your name and age, please?
Oh, yes, doctor. I am Francis Javier, 55 years.
Okay, nice to meet you. I came to know
Nice to meet
that.
you, too, doctor.
Thank you. I came to know that you have problem with your vision. Is it right?
Oh, yes, doctor.
Okay, I'm going to talk about your condition, and I may take down some notes, but all the information during our discussion will remain confidential. So, is that okay with you?
Oh, yes, it's totally all right.
Okay, so can you please tell me what is bothering you?
Doctor, for the last 4 weeks, actually, doctor, I think that I have been facing some problems with the vision. Okay, and in the beginning, I think it was more in my right eye, but now I feel that it's in the left eye as well. Uh, so it's really troubling me, doctor. And and I'm actually a school teacher, so this condition is really hampering my job life as well. So I'm really worried.
Can you tell me more about that? What type of problem you are facing?
Oh, yes, yes, doctor. What happens is that I was told that I was a school teacher. At first, I noticed what that is that I have to teach them by using some colors. Okay, but I started to feel that I had some difficulties in recognizing the color patterns. Okay, the colors, and also after 1 week, I also started to notice that there was some blurring of my vision as well. And nowadays, it even occurs that I sometimes bump into objects. So these are all of these are sometimes are really really bothersome for me, doctor.
Okay, and this is only for the last 4 weeks.
Oh yes, doctor. I think that's for the last 4 weeks.
Do you feel any problem with seeing any part of any object, like any right side, any upside, any downside, or any left side of the object? Have you figured it out?
No, doctor. No, doctor.
And have you noticed that the vision is clear or hazy?
I told you, doctor. Sometimes I think that is blurring of vision.
And is it present all the time or comes and goes?
Nowadays, it is present for a lot of time of the day.
That means you have some good time and you have some bad times, right?
I cannot just specify the good times, doctor. Nowadays, it's increasing day by day, and it's getting irritating.
Have you ever noticed any floating object or anything floating into your vision?
No.
Okay. And you said that you are bumped into object. Can you tell me more about that?
Well, sometimes it occurs that when I am going to the streets or I'm just opening the door, sometimes I bump into the door. Okay, so that's a bit of a problem for me.
Bump your head or any side, right side or left side?
I think no, not in specific side, doctor.
Okay. And can you see any object clearly, or any problem with seeing that object?
Sometimes it's blurry, doctor,
Okay. Have you noticed any changes?
and
In
sometimes
the,
even it occurs that when sometimes suppose it's a pencil and it's well sharpened. Okay, but I don't. Sometimes I don't feel that it's sharpened. Uh, the sharpness, I think sometimes it's affected as well.
do
I
you
cannot
see,
just.
do you see double at any time?
I haven't noticed this double anytime.
And you said that you have sometimes noticed that problem with your color.
Yes, doctor.
Radiation. And this is for the 4 weeks.
Yes,
Present all the time.
most of the time, doctor.
Have you noticed any changes in the color of your eyes?
No,
Have you noticed any pain in your eyes?
no,
Any drooping of your eyelid?
no,
Have you ever seen double?
no,
Do you have any headache?
no, doctor.
Okay. And do you have any rash anywhere in your body?
No.
Do you have any history of raised temperature recently?
Yes, doctor.
When?
Doctor, for the last 5 months.
When do you feel it?
I think it's more in the evening time, doctor.
And do you have any night sweats?
Yes, doctor.
For how long?
Doctor, for the same time, I think.
Okay. And have you noticed any changes in your weight?
Yes, doctor. I think I have lost around 7 kg weight in the last 6 months.
Was it intentional or unintentional?
Unintentional, totally unintentional.
Do you have any pain or any tightness in your neck?
No,
Any weakness at any particular side of your body?
no,
Any abnormal shakiness?
no,
Any history of loss of consciousness during this time?
no.
How about your appetite?
It's quite good.
Okay. And do you have any hot or cold preferences?
No,
Any feeling of sickness or feeling of throwing up?
no.
Any cough?
Not now, doctor.
Any shortness of breath?
Not now, but I had these problems, doctor.
Can you tell me more about that?
Yes, doctor. I told you for the first last 6 months, I have been facing some problem with raised temperature and what you told us might say. And for the same duration, actually, I had some cough, and even I coughed up loud several times. Okay, and but after that, I went to the GP, and they sent me to some test physician, I think, and they did some tests. And after that, doing the tests, they reached a diagnosis, and they started giving me medication for that. And since then, for the last 4 or 5 weeks, I'm feeling quite good. I started those medication around 6.5 weeks back, and for the last 4 weeks, I think I have been feeling quite good.
Can you name that medications?
Doctor, I think I cannot name it, but there are quite a number of medications, doctor. I think there are 4 or 5 medications that I have to take.
And did they say what could be the disease?
Oh yes, doctor. They said that it is, I think, something called tuberculosis, doctor, and they even actually kept me aloof in a room for 14 days, doctor. It was very really painful for me.
Okay, I can understand. And uh, are you taking this medication regularly?
Yes, doctor. I am completely following the advice.
Okay. And I am going to ask you a few other questions that do you have any pain in your tummy?
No,
Any lumps or bumps anywhere in your body?
no,
How about your water work?
quite good, doctor.
Have you noticed any changes like any change in the color?
Uh, Sometimes, doctor, I think there is some yellowish coloration.
Okay. For how long?
For the last 3 weeks, doctor.
Any changes in the color of your skin or color of your eyes, like yellowish?
No, 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 no.
Okay. And how about your bowel habit?
Doctor, good, doctor.
Do you have any joint pain?
No, doctor.
Okay. And is it okay if I ask you about your past medical condition? That do you have any significant past medical condition except this recent?
Nothing. I don't think so, doctor.
Okay. Any history of disease in the liver, high blood
No,
pressure, high blood sugar? Okay, that's
no, no, no.
history of transfusion.
I actually I'm quite a healthy person, doctor.
Okay, and you are taking this medication for tuberculosis. Except those, are you taking any other medication?
Oh no, doctor.
Any over-the-counter medication?
No,
Any herbal products?
no,
Do you have any allergy to any medication?
no.
Okay, and any of your family members have any significant disease?
Not that I know of, doctor.
Is it okay if I ask you a few personal questions?
Yes,
Do you smoke?
yes, doctor.
How many sticks for how long?
Around 10 sticks for the last 15 years.
Okay, I would like to recommend you to stop smoking because it is related to your condition. And if you need help, I can refer you to the smoking cessation clinic.
Okay.
Do you drink alcohol?
No,
That's fine. May I know that what do you do for living?
I told you, doctor, I'm a school teacher.
Yes, I can understand. And uh, is this this condition is also affecting your job? And in that case, I can contact the occupational health department, and they can find any suitable adjustment at your work.
Okay.
And may I know that do you drive?
Yes, doctor.
Okay, and in this case, I would recommend you stop driving until we are sure what is happening with you.
Okay.
Do you have any history of recent travel?
No, doctor.
Okay. And is it okay if I ask you few very personal questions? It is necessary, and it is not to demeanor you or not to make you uncomfortable, but it is really necessary to know.
Okay.
May I know that whom do you live with?
Doctor, I live with my wife. Doctor.
And do you have any history of any casual relationship?
No, never, doctor.
And have you ever taken any blood or any other drugs through your blood channel?
No, doctor.
Any history of tattooing?
No.
Okay, fine. And may I know that what is your concern? 2 minutes meaning.
No, doctor, actually, what's causing this problem, doctor? Am I going to get blind?
Actually, I need to examine you, then I could give you the best explanation. And at this point, a few things come in my mind that it may be related to the medications you are taking currently for your equilibrium in the chest. That one of this medication can cause this type of symptom. For this, I would stop the medication and I will take review your medication, and I will give you the best management that is available at this time. And in the meantime, there are also certain other possibilities that you have this condition, and this can also affect your brain so that you are having this type of symptom. For this, I will also need to run some blood test, some imaging test of your chest, and also imaging test of your brain. And also, I will have to look into your eyes, and after that, I can give you the best explanation. Do you get me?
Okay, doctor.
And do you have any other question?
No, doctor.
Okay. So, and also, you may need admission, and is it okay with you?
Okay, doctor.
Okay. So, I am going to arrange for all this, and also, I am going to stop these medications currently, and I will get back you soon with the medication that is should be continued now.
Okay, doctor.
Okay, thank you. Do you have any question for me? Time up.
No, doctor. Okay. So can you please, okay, so would you like to examine the patient now?
Yes.
Please continue.
Okay, first I will examine the hand for any clubbing.
Okay, no clubbing.
Then I will examine the pulse, then blood pressure.
All right.
Then I will look into the eyes for any jaundice, anemia, or any drooping of eyelid,
Uh,
any pupil.
so- okay, some anemia present.
Okay, and after that I will go for the visual field and visual acuity.
Yes, visual acuity reduced. Visual field there is a reduced peripheral vision.
Okay, and at this time I will also need to go for Sierra test and fundoscopy.
Yeah, fundoscopy there is a bright, well demarcated optic disc.
Okay, and after that I will go for the lungs for any crepitation or any dullness present.
No, lungs are quite clear at this moment.
Okay, then I will ask the patient to then I will go for the plantar reflex.
Oh, all right.
Okay, then I will ask the patient to walk.
Oh, it's he can walk,
Okay.
but there is some problem due to his eyesight. So he wants to take some help from you.
Okay. I'll, after this walking and at the time, I will also feel the neck muscle for any tightness.
No tightness.
Okay. This is the examination.
Okay. So, okay. So, what do you think the diagnosis is?
Okay. For this, there are few possibilities, and that is this can be optic neuritis due to ethambutol use, and also this can be due to intracranial space occupying lesion like tuberculosis or any uh, other brain tumor or any brain abscess.
Okay. So, if there is any intracranial space occupying lesion, what would you like to see in the fundoscopy? What would you expect to see in the fundoscopy?
Okay, actually, if it was in the intracranial space occupying lesion, if it was pressing the optic nerve, then there could be signs of optic atrophy at that site, and other side there can be signs of papilledema.
Yeah. So, was there any papilledema present in this case?
No, but that can be for initial stage of intracranial space occupying lesion.
Okay. And do you think that optic neuritis is present in this patient? There is no pain on eye movement or any normal resting eye pain.
Okay. For ethambutol induced optic neuritis, they can present with loss of color vision.
Yeah. Okay. That's all right. And so now, how would you like to investigate the patient?
Okay, first the investigation would comprise of routine blood test, that is complete blood count to see anemia and white blood cell count, liver inflammatory markers, then liver function test, renal function test, even for routine examination. And after that, CT scan of the brain. And if it comes normal, then I may need to go for lumbar puncture study, and also I go for the chest X-ray.
Okay. Would you like to do some perimetry or some electroretinograph?
Yes, I would like to refer him for the ophthalmological review.
Okay. So how would you like to manage the patient?
This is a multidisciplinary approach, as this could be due to the drug-induced cause. So I'd like to stop the drug and review the medication, and this patient may need admission, and also he may need some steroid injection. And for first, I will have to form the multidisciplinary team with ophthalmologist, with pulmonologist, and with a neurologist, and also infectious disease specialist, and also physiotherapist for his condition, and a specialist nurse.
Okay. 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 That's all right. That's all right. So would you like to add anything?
I cannot remember.
Okay. So would you like to rule out some other causes in this patient, like his dietary habit or any lead exposure or any lead exposure? Do you think that this can be important?
I cannot correlate those.
Yeah, if it was optic atrophy, just core optic atrophy, aren't those some causes of it?
Okay, for optic atrophy, there are lots of causes, so I cannot.
Yes, now toxin,
Talk.
we including toxin, tobacco, alcohol, lead poisoning. I think these are important, and then vitamin B1, B6, B12. I think these are also important. Okay, although these are rare and very long time may be needed, and for subacute there can be MS or neuromyelitis optica, and you ruled that out really well. And in case of sudden, I think non-arteritic or arteritic ischemic optic ischemic neuropathy, optic neuropathy. This can also be important, I think. Okay. Okay. So Would you like to add anything?
No.
Okay, so I think we can stop the recording.